Okay, let's talk about open bite cases now, because you can also treat open bites with Powerprox 6-month braces. And in that last case, remember I said he had such shallow overbite and he was skeletally open, I would treat him like an open bite case. So you're going to see how we would do that. Okay? Open bites. Now, what you want to know when you're treating an open bite is this a dental open bite only, or is it a skeletal open bite? A dental open bite is far easier to treat than a skeletal open bite. These are usually due to habits. The patient was a thumb sucker oftentimes, or they're a tongue thruster. Now you have to stop the habit to ensure your long-term stability. Tongue versus teeth, tongue wins. Thumb versus teeth, thumb wins. And just because the patient is 25 years old, don't necessarily think that they don't suck their thumb. I had a patient in not long ago, and big open bite. She's like, I'm a thumb sucker. I'm like, and she's 25 years old. And I'm like, do you still suck your thumb? Well, yeah. Okay, if you don't stop that habit, the case will relapse. Now, tongue thrust. Just like I told you to look for tongue thrust in those spacing cases, make sure you're looking for them in your open bite cases as well. Now take a look at this situation here. She has a little bit of open bite between her incisors on the one side. Now look at her when she swallows. Do you see how the tongue shoots through that hole? Do you think the tongue has something to do with that? You bet it does. If we don't retrain the tongue to not do that, the case will relapse. And again, that tongue thrust video, all you have to do is, tell the patient, bite down and swallow real fast 5 times. You don't want to say bite down and swallow, just once, because then they might be self-conscious of it. Say, swallow real fast, like 5, 6, 7 times. So you can really see what the tongue is doing. If the tongue is shooting through there, okay, either with spaces or an open bite, it's a tongue thrust, and it has to be addressed or the case will relapse. Now, if you have a skeletal open bite, these are harder to treat than dental open bites. These are usually due to growth patterns, not habits. Now, these you're generally going to want to refer. So if you have, that anterior dental open bite and their skeletally open bite, refer. What's the easiest way to determine if they're skeletally open or just dentally open? Look at the ceph. Where is menton, bottom of the chin, in relation to the vertical arcs of normality? Is menton within the arc or above the arc? Okay, that's what you want to see. If it's below the arcs, okay, with that big wide open mandible, that's a skeletally open bite. That's a case you want to refer out of your office. Again, look at that mandibular angle. Okay, is it wide open? Because the great majority of the time when you have that wide open mandibular angle, once you look at the ceph tracing, menton's below the vertical arcs of normality, skeletally open, much harder case than if they were a thumb sucker with a nice flat angle and menton within the arcs. That's how you know which open bite case to treat and which to refer. Again, poor man's cephalometrics. Obviously at your consultation, you're not going to have a cephalometric film. Just look at the patient. The side view. Wide open angle or a nice flat angle. Gives you a great way to kind of judge before you go ahead and take records. So here's a situation where we have an anterior open bite. What we want to know is it skeletal in nature or dental in nature. You can see this patient has menton, bottom of the chin, within the arcs of normality. She has a flat mandibular plane angle, and with our history we found out she was a thumb sucker. These are the ones you want to treat. Okay? These are typically more straightforward than a skeletal open bite. So these are the kinds of open bites you can treat with Powerprox 6-month braces. Conversely, a skeletal open bite, when you have an anterior dental open bite and you have menton below the arcs and that wide open angle, these are due to growth patterns, not habits. These are the cases you want to refer out of your office. These are much more difficult. Another tip-off is look at the occlusal plane. On a dental deep bite, you'll usually see a stepped occlusal plane with the incisors, above the posterior teeth. Whereas a skeletal open bite, you'll usually see a straight occlusal plane. A skeletal open bite, they grew like this, so they're open, okay? Whereas you have that nice step on the dental. So what do? Once you level the line and rotate that back to level, it's closed automatically. So you want to do the dental open bites, not the skeletal open bites.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/Powerprox Lab.